that values the Parker Family Health Center, but we couldn't do it without our volunteers. We'd like to thank our doctors, our nurse practitioners, our nurses, our interpreters, and our administrative assistants. We thank you all.
We can actually spend the time to listen to patients. You can learn a lot from listening to patients. You can learn about their lives, their children, their family. What we do here is we treat the whole patient, and we are funded by donations and grants from very generous people in the area. Our donors really help us here to perpetuate our help to the needy people in the community. It's very nice to give hope to these people who have no insurance and really need a good doctor to listen to them and treat them properly. I had a patient once who had terminal cancer, an older woman. Every time we came in, we would discuss her case with herself and her family. And at the end of the visit, we would do a little dance. And this became part of a ritual for her and I every time she was here. The patients here actually energize the doctors. You can come into the clinic in the morning as a physician feeling tired, but when you leave, you feel very energized because of all the good you do for the community and the patients. We actually do things here like no one else. We treat the whole body, the mind, the heart, and the spirit of the patients. And nobody does it like we do here at Parker. So please don't hesitate to donate to the Parker Family Health Center. Thank you very much.
We rely solely on funding from grants, private foundations, running special fundraising events throughout the year, and from private contributions from generous supporters who believe in our mission. We are fortunate to utilize the expertise of about 180 medical and non-medical volunteers, and we're so appreciative of their time and their talent. Our patients truly receive quality, comprehensive health care. I'm thrilled to have the opportunity to impact Parker Family Health Center and to continue our mission to serve the community. We're so thankful for your ongoing support.
I'm very proud to be a part of the Parker Family Health Center. It's a very special place where people from Monmouth County who do not have health insurance can come to receive their medical care at no cost. Not only do they receive their primary care there, but they also can schedule appointments with specialists according to what their health issues are. At Parker, the patient is able to come back and see that specialist at our facility. It is a very unique and special place in Tears.
So here, we know our patients very well. I know them from memory in most cases. A quick look at the chart reminds me of their problem list and the medications that they're taking. And we're able to pick up where we left off and make sure that the care they get after this visit is even better than the care they received in previous visits. Why? Because we know them better.
Here. The care here is so genuine. Everybody here is doing this because they want to. They're not doing this because they have to. They're not doing it for the academic.
There are people who just cannot afford health insurance. We try to fill that gap and provide health care for all who cannot afford it through traditional means.
Nobody chooses to be a sick person, and it's bad enough to be sick. It's terrible when you're sick and you have no place to go. So Parker is a place where people can go instead of the emergency.
The world experienced that economic decline. The business that I was in, marketing, public relations, and business development, took a drastic turn. I couldn't afford my medical care any longer. I was paying $1,000 a month, and I had some chronic health issues. I am incredibly thankful for Parker being here and for what they do.
For me to recall Gordon, however, Gordon to me set the standard for what it means to be a Board of Trustee member. In short, Gordon was the best ambassador we ever had. He was free to speak of Parker in any setting at any time. We still speak of him and miss him dearly.
Carol, I don't know how to describe in just a minute how much you mean to the people of the state of New Jersey or to the people of Monmouth County or quite frankly to my family. It's getting me emotional just thinking about it. You know what you mean to my son and to his career through your family. You know what you mean to my family. You know what you mean to just the people here in Monmouth County. Anybody who calls Carol Stillwell and asks for anything gets twice as much. So Carol, I wanted to say congratulations for being honored tonight, but also thank you from the bottom of my heart as a friend of yours for far too many years, and also from the people of the state of New Jersey, because people like you are the reason why New Jersey is such a wonderful place to live and raise a family. So thank you, Carol. Congratulations to you and to your lovely husband, Gordon, and to Mary Ann Larkin. I know she's your twin sister in every different way. So stop giving the shirt off your back. Please say no every now and then, but keep being who you are, because we all love you.
Parker family to me means hope. In my journey in my life, I knew how important that was, not only for me, but for many people whose lives I personally touched. And when Jean Cheslock had come to one of our horse shows, it was actually Ride for Riverview, raising money for the Booker Cancer Center. My late husband Gordon was there, and Jean came, as he always did, to attend many of those events. Gordon had the opportunity to meet Jean. And I remember when he left that evening, he came home and he said, "Oh my God, did you know Jean Cheslock is such a remarkable man?" I said, "Well, you know, Gordon, I know that I'm 20 years younger than you, but yes, I know that. I've had the pleasure of working with him and Paulette Roberts because of the Riverview Center. And it was my opportunity at that point in time to come on the board of Riverview. And Riverview does so many remarkable things. How did Jean impress you?" He said, "Oh my God, do you know what he does?" I said, "I already told you I know what he does." He said, "He gives hope. That's why I love Jean, I told you. He does give hope. He brings hope and medical care and attention to those who would never have that opportunity. And they know that if they walk into the Parker family, that's their home. That's their family. And Jean and the Parker family have done that for all these years." He was so touched by Jean and the mission of the Parker family. One day he came home and he said to me, "You know what I'm doing?" I said, "No, Gordon, I don't know what you're doing." "I'm going on the board of the Parker family." And I paused a minute and I said, "Gordon, do you mean one of the boards that you have often said to me, 'Carol, why do you sit on so many boards?'" And I said, "Because boards need good people. Because boards have great missions. And you pick the right board, and you two will make a great team. The Parker family, Gordon Stillwell, perfect together."